Hey everyone. Okay, I get asked a lot about scheduling. Now, in the past, I have worked to optimize my schedule to the nth degree, and I recently changed from a fee-for-service pediatric practice to a direct primary care. So that has completely dissolved the need to do that, but I recognize that there are a lot of people still in the space where you need to be able to see patients efficiently, see them quick, make them feel heard and understood, and also keep up with volume, charting, all those other things. And I can see myself talking with my hands on this video. Okay, I'm gonna move this so I don't have to look at my own shirt. So what I'm going to talk through today is the wave scheduling, and I've used this for about the past 5 or 6 years and found it through some online searching or friends or colleagues or coaches that had recommended it, and it is a fantastic way to see more patients per hour without making patients wait and without getting too stuck in the weeds of seeing patients and feeling like, gosh, I get behind and then I can never catch up, and patients arrive late and then I can never catch up with them. This is not really a primary tool to just like fit more patients in per hour necessarily, but what it does for you is it builds in cushion so that if a patient is late, that it doesn't completely derail your morning. Because we know that, and this is true for me too, if my dentist appointment starts at 9 o'clock, I walk in the door at either 8:59 or 9:03 or something like that, when they're expecting me to be sitting in the chair at 9 o'clock to start the appointment. Same thing for you, and we can try and tell patients, arrive 15 minutes early, but nobody does that. So this provides for a buffer so that your patients get seen and you do not get so far behind when they show up late. So the way a wave schedule works in general is patients come in waves. That's the whole purpose of it. So if you were going to draw, a normal hour of your time, let's say we got 9, 9:15, 9:45, and 9:30, and then 9:45. Sorry, you might do 4 slots, and you could do a well check and a sick, and a well check and a sick, and then what happens is this well check arrives late, or the sick patient gets stuck in the car or vomits in the waiting room or something like that, and then everyone starts to slide down the day, and you certainly never catch back up because all of your patients are still arriving, but you're trying to play catch up because your 9 o'clock didn't walk in until 9:10, and then they need to feed their baby, and then it's 9:30 before their green lights on that you can even go into their room and see them. Sorry. So everybody knows how easy it is to get behind in that model. So instead, what you're going to do, so this is normal, and this is a wave. So the wave, you would say, okay, at 9 o'clock at the top of the hour, I'm going to have a well check and a sick visit arrive. What that does is it protects you so that when one arrives on time and one doesn't, you can see that one while your nurse is checking in the other one. And then at 9:15, you're not going to have anything. And then at 9:30, you're going to repeat the process. Here's how it ideally works. If everyone shows up when they're supposed to, your nurse checks in the sick visit quickly. So you would see sick, and then, so we'll call that sick 1 and well check 1. You would see sick 1, while she is rooming, or he is rooming well check number 1. And then once they're ready, you'll be done with the first sick visit, and then you can see well check number 1. That works perfectly. The sick visit gets seen right away, so they are happy. They're in and out quickly. It's, typically it's something easy and straightforward. And then the well check is seen next. And then, you finish up your well check as your next well check and your sick are arriving. And so then if we have well check number 2 and sick visit number 2 here, same exact process repeats. Now, they might not even be ready, so then you could catch up on your charting at that time. And then you can go in and you can see sick 2, well check 2, and then catch up on your charting again. That would be the ideal arrangement. Everybody's taken care of. People arrived at 9 o'clock. They got seen and out of the door by 9:30, 9:35. And then your well check and your sick were arriving while you were finishing up with well check number 1. And then they get seen and taken care of. And then you can repeat the cycle over and over again. Couple things that I'd want you to take into consideration is when you do blocks, it works best to block below rather than next to. If you know that this well check or this either well check always has a lot of extra questions and you want extra time, then what I would do is block the 6 spot there and then have that be blocked. What happens is we have a well check at 9 and they always have a lot of questions, so we're going to block for them, and then we block the 6 spot. Well, they still showed up at 9 and it took them 10, 15 minutes to get all checked in and everything, and you're sitting there doing nothing while they're getting checked in when you could be seeing that sick and then making up for this long well check in this time. So hopefully that makes sense and it helps. What I did, I don't know if you can see this, what I did is I'm pretty efficient in the exam room. So if this is 9 and this is 9:15 and 9:30 and 9:45, I would sneak in one extra visit in there. So I do a well check and a sick, and then at 9:15 I'd have a sick, and then at 9:30 a well check and a sick, and then nothing at 9:45. And that actually allowed me to see one extra patient per hour. And it's easy to block that spot if it seemed like, okay, I just need to catch up or something like that. And it actually increased my clinical volumes by like 30% within that same hour, just over the course of the day, being able to see and work in additional patients. You can also always keep something as like a same day sick, which means that nobody can book it until the same day. And then if, somebody booked here and they always take a long time and we've got a sick one here, this one is the same day sick, and so we're just going to block that so then that nobody schedules in that spot and we can keep things caught up. So that's another kind of arrangement of that where you can actually sneak another patient in. Now, what this can do for you is it lets you know that, okay, if one of these arrives late, hopefully one of them will arrive closer on time. Ideally, the sick will arrive on time or closest to it. They're quick and easy to check in. If worse comes to worse, I can run in and see them and get their Respers and their pulse and their vital signs and do that visit while my nurse is checking in the well check, and then we can keep up with our day. So I know that a lot of people really struggle with getting patients in a timely manner and not having long wait times, and the wave schedule is one really good way to keep on track. So if you pair that with a scribe, you can see a lot more patients and have a much better lifestyle, and I highly recommend considering a scribe. What I know about scribes is I've had scribes for the past 5 or 6 years. All 3 of them were pre-medical students that took an extra year to finish, to get from graduating undergrad into starting medical school. So they had the perfect schedule to work with me because they were available. They got an amazing clinical experience. I mean, my one scribe that was with me for 2.5 years saw 12,000 patient visits. So an unparalleled experience that no one else in his medical school class had by a long shot. He was so good that, towards the end, he'd be like, hey, do you think that 15-month-old has autism? And I'm like, yep, I do. And you caught that as a student that hasn't even gone to medical school yet because you've seen so much that you get comfortable with that. And so I would highly recommend a scribe. I actually, a while ago, this was before the pandemic, put together how to find and train a scribe workshop. And I'll put the link for that in the notes below. But what that will do for you here, oops. I don't know what I did there. What that will do for you is it'll give you time back, time to spend with your family, time to focus on what you need to, time to focus on your patients and see the patients that you need to see without worrying about getting behind in your charts and everything like that. And then you can go home knowing that your charts are 90% of the way done, and you can just sign off and change a few things here and there and be done with your charts and not spend your evenings doing charts. And so I'll link to that below, but I would highly recommend you consider a scribe. I calculated the math and I never paid for a scribe even one day. And I actually paid for the scribe myself out of my own pocket rather than my practice paying for it. And the reasons for that is the scribe allows you to document appropriately, so you can bill appropriately. It's not like, okay, I'm just going to do a 99213 because I definitely did a 99214 level of work, but I just don't want to chart that much. It allows you to get on that extra patient or work in a patient, which makes patients happy, and it also creates more revenue opportunities for your practice. And even if it didn't, financially work out in your favor, you're still restoring all of that time to your life. And that is worth more than any dollar amount that you could get. So I would say there's no good reason to not have a scribe, period. I can't think of a good reason to not have a scribe. Hope that helps. I'll link to the Scribe workshop below if I can find the link to it so that you can enjoy it and learn from it, and keep up the good work. Hang in there.